Shall we start, sir?
अभी हुआ नहीं है.
I think it's late, sir.
Now it is live.
Good afternoon, everyone. Good afternoon, sir.
Good afternoon, Dokiti.
Welcome to Facebook Live session from Dr. Makkar's Diabetes and Obesity Center. The topic of today's session is frequently asked questions about obesity. Talking about obesity, obesity is a complex disease involving excessive amount of body fat. Obesity isn't just a cosmetic concern, it's a medical problem that increases the risk of other diseases and health problems. Actually, India is racing towards global health crisis that has been overlooked for years. And the fact it has been ignored and we fail to recognize obesity as a disease. And it's for sure, we all have plenty of questions regarding obesity. So let's know more about this disease. Good afternoon, sir.
Good afternoon once again. Good afternoon, everyone. Hope you're going to enjoy this session also.
The first thing we all want to know is what exactly is obesity?
Yes, so it is very important to understand what is obesity. So what happens is we normally measure, obesity or assess obesity in lay terms, in terms of body weight. So we say somebody has obesity or overweight. Weight is more or grossly more, than it is called obesity. Now, obesity by definition is not just excess of weight. It is excess of fat in any individual's body, which is the excesses of an amount that is causing damage to health. So, any excess fat in body that is detrimental to health is a state called obesity. Now, obesity is basically defined on, basis of body weight, because measuring fat directly is very, very difficult. To exactly measure body fat, we need to, subject the individual to either a DEXA scan or a MRI and calculate fat from there. Second thing is the exact cutoffs for fat are not very well defined in various populations. So we use surrogate measures of measuring fat, which is the excess body weight, and we usually measure it based on body mass index, which is calculated from height and body weight.
So what we are seeing is obesity is on rise worldwide among both sexes, all ages, across all races, ethnic groups. So what are the health risks which are associated with obesity?
So as they say, obesity is possibly the mother of all important diseases of adult life, whether it is mechanical or it is metabolic diseases or it is cardiac diseases or it is cancers. So obesity actually increases the risk of developing multiple disorders, including, the major metabolic health issues are development of diabetes, cholesterol abnormalities, insulin resistance, polycystic ovarian disease in young girls and women, infertility. If there is gross obesity, it can lead to infertility in women, menstrual disorders. Then it can lead to diabetes, increased risk of blood pressure, increased risk of heart disease, increased risk of kidney problems, increased fatty liver disease, and ultimately, if it is prolonged, it can go to even liver cancer. All kinds of cancers are increased in obesity. All kinds of joint problems, because you have to carry excess weight all the time, so your joints get stressed and damaged faster. Obstructive sleep apnea, which is again one of the major issues now, is increasing with obesity. So virtually all kind of things, lung disorders, breathing problems, even the risk of COVID was very high in obese individuals as compared to non-obese individuals. The risk of mortality, risk of admission to ICU, risk of getting ventilator support was much higher, is much higher in obese individuals as compared to non-obese individuals. So obese individuals actually have an immune compromised state plus other multiple problems which predispose them to a number of comorbidities and mortalities, the complications that are related to obesity. And there is increased risk of death also. Early death is there. There is a quote which I remember not very correctly. It is from, I think, Omar Khayyam. Ages back, there is a quote that obese people live happy. Obese people live happy, nevertheless, they die younger. So this observation was there a couple of centuries back also, when there was hardly any obesity.
So, what causes obesity? What are the factors which lead a person to be obese?
Again, very important question. So what happens is usually we blame the individual for being obese. Whoever comes with overweight or obesity, we tend to blame, this person must be lazy, must not be exercising, must be eating more, eating junk food and everything. But one has to understand that it is not a behavior disorder. Obesity is caused by a very complex interaction between genes, epigenetic factors, and environmental factors, which ultimately lead to increased consumption of calories, which is in excess to the daily requirement of an individual. And there is an imbalance between calorie consumption and calorie expenditure, leading to a positive balance of calories, which is stored in shape of fat in the body. Now, when we say it is not on one side, I'm saying, it is not just eating and being lazy. On the other side, I'm saying that there is a imbalance between calories. Person is consuming more calories and burning less calories. So it seems, two are very simple things. But this increased consumption of calories is not simply because of the habit. There are, abnormalities in the, the communication between various neural and hormonal pathways in brain and in various parts of endocrine system. And in fact, the fat also, earlier it used to be thought as a storage organ for storing fat. The adipose tissue is actually, now we understand that this is one of the major endocrine organs. So once there is excess fat, there is inflammation, there is secretion of abnormal hormones from the fat tissue, which leads to, changes in signaling in the central level, in endocrine glands, and net result is that there is a positive accumulation of fat, which once it crosses a certain critical point, everybody has a different tolerance for excess fat deposition in the body. So someone can become metabolically abnormal, develop diabetes, hypertension, increased risk of heart disease at very low accumulation of fat. And some people will not get diabetes unless they get very high amounts of fat in the body. So individual, response to that fat accumulation is also variable. But there are multiple factors. There are central signals in brain, there are endocrine components, and there is, of course, the, physical activity levels of individual, which ultimately contribute to development of obesity. And there is genetic predisposition which has to be there.
So what we are seeing is there is a rise in childhood obesity also. So how do you take this thing?
So, it is very interesting. There is a hypothesis called Barker's hypothesis, which talks about intrauterine programming of the fetus or baby. Now, if we look at the epidemic of obesity that we are seeing, the increase in numbers of obesity, actually the numbers have multiplied over last 2 decades majorly. in last 4 decades, in last 40 years, the number of obese children has gone up by 4.5 times, right? So 450% increase in 40 years. Now, we don't expect that genes have changed in 40 years. Genetic changes happen over centuries and, multiples of centuries. They don't change in 20 years, 30 years, or 40 years. But genetic expression and epigenetic factors, that is the influences on genes because of the environmental changes, can lead to changes in the genetic expression and different kind of changes in phenotype or of the body shape. So it is expected that what happens is once the baby is exposed to a malnourished environment or malnutrition in utero, that is inside the womb, then the genetic programming is such that now this baby is programmed to expect famine or malnutrition or decreased availability of food when child is born. And this was the situation because 40 years back, India was a poverty-ridden country, and we were still very early in the development stage. Now, what is happening is that programming of, and even today, 20% of the population is undernourished or malnourished population. Now, when these ladies become pregnant, under the influence of malnutrition, the baby is exposed to a malnourished environment in utero, gets programmed to face that malnutrition or scarce availability of food when born, and gets exposed to excessive availability of food. Now, programming is such that you will get less food and you have to survive on that. So the child is programmed to survive on less food and getting more food. So excess storage is happening and they become obese very fast. There is so-called early catch-up growth and they are programmed to become obese. So this is kind of indirect influence that we are seeing from the in utero, malnourished state also. Otherwise, there is increased availability of food now, decrease, mobility, increased availability of transportation. As a child, I used to walk to my school, which was about 2 kilometers. Now, nobody walks 20 meters also outside the house. You expect somebody to come and pick the child right from the gate. So those things have changed. The outdoor games have decreased for children. Every child is, glued to a screen in whatever form. The screen time has increased. A lot of studies have shown that if your screen time is more than 2 hours, there is significant increase in the risk of developing obesity. So multiple factors are there, but in nutshell, there is a genetic programming which predisposes you to easy or excessive accumulation of fat, and there is decreased physical activity which kind of facilitates this accumulation of fat leading to obesity.
So, should we call obesity a disease or a sign of prosperity?
So, again, this concept of sign of prosperity was because 20 years back or 30 years back, people were barely getting 2 square meals. And they were all thin and lean. So somebody was getting obese. It was thought that this person or this family has sufficient food to eat. And they are prosperous family. And that was the notion that was ingrained in the people's mind, that somebody is looking plump or overweight was thought to be healthy, because everybody had seen malnourishment and lean and thin emaciated people. Now, this was not recognized as a disease for quite a few years, till we started understanding that this overweight is causing a lot of problems. Overweight and obesity is the key driver for diabetes development. The prevalence of diabetes has increased in parallel with obesity, and worldwide prevalence of diabetes, whatever predictions have been made, actually have been surpassed because nobody accounted for the development of obesity in the background. So because of obesity, whatever numbers we thought we will have in, say, next 10 years, we get those numbers in 3 years or 5 years. Because obesity is driving diabetes very, fast, very aggressively. Similarly, we have increased risk of heart disease with obesity. Now we are seeing more and more kidney disease, liver problems. So obesity is a major health challenge, and it is definitely a disease. It has been recognized as a disease by various governments and society associations, and European Union has recognized obesity as a disease. Uh, America, it is labeled as a disease. India, I don't think it is still labeled as a disease.
So the answer to this problem is losing weight.
Yes.
So sir, why to lose weight, how to lose weight, and how much to lose weight? This is my next question.
So why to lose weight is simple, because there is enough data to show that if some person who is overweight or obese and has excess fat which is causing metabolic or other problems, losing weight corrects all these things or significantly improves that. So there are clear-cut studies showing that if somebody loses 5 to 10% of body weight, there is almost 90% improvement in metabolic parameters like diabetes, blood pressure, risk of cholesterol disease disorders, risk of heart disease, everything improves. Higher weight reduction, the joint problems, the lung function, the sleep apnea, all these things also start improving. So till date, recommendation is that one should try to lose at least 5 to 10% body weight to have a significant improvement in the metabolic state as well as the health state of the individual. How do we do it? There is, one has to focus on lifestyle changes, because as of now, we do not have any magic pill or any kind of, panacea which can give us a quick fix solution that once you take this treatment, after that you will lose weight and you will not regain weight. So with dietary modifications, moving towards a healthy diet and caloric restriction and increase in physical activity, supported by some approved medication, one can lose weight, which goes in the range of usually 5 to 10%. More than 10%, now we have some new medications which are available outside India, which I think shortly by next year we will have those available in India also. And we are able to induce weight loss in the range of 15%, which is very, very significant. Some people who have morbid obesity and are not able to lose weight with the medical management, which includes lifestyle and medicines, then the option is bariatric surgery. So these are various options that one can think of, losing weight.
So can you give some tips for the mothers to help their kids reduce weight? Because usually females, they don't accept their kids are overweight.
Yeah, they say they are healthy.
So how to diagnose the obesity for a layperson?
First thing is they have to understand that being plump or obese is not healthy, it is unhealthy. So that concept has to be, kept in their mind. Second thing is diagnosing obesity is not difficult. It's very simple. You look at any individual, you can make out whether this individual is thin or, overweight or obese. Simple thing is, if your stomach is, you have a small belly or a large belly, it doesn't matter. If you have a belly, you are overweight or obese. And India, actually, the central fat accumulation is very, very significant. And this is one of the major culprits for increasing other diseases. Otherwise, something, yeah.
Is it same for the kids also? Central
kids
obesity?
Actually, if they have belly, it is grossly obese, because kids don't get belly. They generally get overall accumulation of fat. And once they have become obese, then only they start showing a belly. So overall plump look of the children, and you have to keep a track on milestones. I think adults lose track of their weight and height and all those things. But usually the children, they are under constant supervision from pediatricians because of regular vaccinations and other things. So one should keep track of their landmarks, developmental milestones. And mothers can easily pick up if the weight is going beyond the 85th percentile of what it should be for that particular age. And if it is more than 85th percentile, it is definitely overweight and you have to get alerted. Second thing is you have to make sure that children are physically active. Third thing is the eating, whatever child learns to eat at home, right? So if your eating habits are bad, children are going to have bad eating habits. If you are fond of junk food, children are also going to have, that inclination for junk food or outside eating or restaurant eating or whatever, excess eating, right? Another important thing is children are given food and made to sit in front of TV. So they lose track of whether they are hungry or not. They are more glued to TV and eating becomes a reflex phenomena. They tend to overeat. So there are so many things that are there and they have to be taken care at mother's level or parent level, I would say, to make sure that children don't become overweight or obese.
Right. So, in fact, I think we doctors should also recognize obesity as a disease. We should make the diagnosis of obesity.
Yes, it is very important. And most of the times, the problem is generally for small ailments, one intends to visit the general practitioners and general practitioners or government hospitals, wherever person goes. Unfortunately, we have too many patients to be handled by any doctor or medical person. So they hardly have time to spend on other things except for the main problem that person comes with. Ideally, every patient walking into a healthcare facility, like we check pulse and blood pressure and temperature, we should also check body weight and waist circumference. And we should be able to understand this person is obese. And right there, actually intervention is required in terms of counseling and lifestyle modifications. But there is no support staff in most of the primary care physician clinics or the government hospital. And it is a neglected area. Nobody is writing the diagnosis of obesity or nobody is talking to person about obesity. Second thing is, even those who can take out time and talk to the patient, that conversation appears to be little touchy and sensitive, especially if you have ladies who are overweight. You don't want to tell them you are overweight or you are you need weight reduction, though they may be more willing to lose weight as compared to men, right? So touching upon this point that somebody is overweight and you really need to discuss, counsel them, needs time and support staff, which is missing in most of the clinics. And that is why it is being missed. But I think just putting a diagnosis also, or just subjecting the individual who is coming to a clinic or medical care facility, if they are subjected to weight measurement and waist circumference measurement, and they're just told that this is above your normal level, you should, seek help for this. That will go a long way in, bringing obese individuals to the fold of lifestyle changes and treatment.
So the main question, the main point which hits on our mind is, okay, can I look good? Can I have a good physique with weight loss? How do you take this thing?
So, very difficult question to answer. See, looks are something which one, perceives about oneself. It is not how I feel about somebody that somebody looks beautiful or not. More important is one's own perception, whether I look good or beautiful, and that helps in, building up self-confidence also. that my personality should, everybody has some kind of perception about one's own personality. So they want to kind of develop that. Now, if weight is part of that, it becomes a concern. If weight is not part of that, you would see so many people who are grossly obese, right? They are not bothered about it and it doesn't impact their personality. There'll be others who are not so obese, still they are concerned. So it is a different thing. So looks is something which is one's own perception. Yes, if that perception is that I am overweight or obese and it's a major concern, weight loss will help improving that. But that is not the only thing that will change it, right? Now there are populations in outside India, or even if you look towards south, the culture is to look little plump. You will not see any film actor in South movies who's slim. They are all little overweight or obese. Same is the actresses. Even the lead actresses, they are overweight and obese. So their culture is, their perception is that little extra weight looks more beautiful or more healthy. Similarly, if you look at the South African populations, the women who are thin or normal weight are thought to be, having a low level of fertility. And obesity is kind of thought to be related to a better fertility. Those kind of things are there. So every population and every individual has a different notion. Now, important thing is people who lose weight for improving their beauty aspect or looks. Somebody who's grossly overweight and loses significant weight, there can be challenges. Because once they lose fat, a lot of fat, the skin is already overstretched and they tend to develop skin folds over abdomen or the sides or maybe back also. And then they become, very concerned now what to do with this. So they have to understand that what amount of weight reduction should be done, what should be the modality of weight reduction, what will be the end points if someone loses that much weight. Suppose you develop folds, would you like to go for a plastic surgery, or you're covered, you can cover them with clothes and you are okay with that? So all these things can be there. So somebody is just trying to look beautiful by losing weight, may not be the end point.
The next thing which comes is, will I achieve all health benefits by losing weight?
More than 90%, yes. If you lose more than 15% body weight, almost all kinds of health benefits are there.
So what we are talking about is not body shaming, but it's about being healthy.
Yes. So perception of beauty is very different. Everybody has one's own mindset.
What is the best strategy to lose weight?
So weight loss has to be a very, very comprehensive weight loss program, which has to be in place, whether it is in a medical clinic or it is in a surgical clinic, that is required to help weight reduction. Second thing is weight maintenance. So basic principle is that you have to create a negative calorie balance. As of now, we don't have any medication which can cure obesity. Even bariatric surgery is not a cure, because 30 to 35% patients will regain body weight what they have lost. And in our center, we are treating people who have regained after bariatric surgery also. So there is no cure. For all these obese individuals, first option should be a lifestyle intervention, aggressive lifestyle interventions, and medications, of course, approved medications. And if with that somebody can lose weight, first target is always 10%, 5 to 10%. Once your person has lost 10%, if the person is willing to lose further, then second 10% is the target. But after whatever point you stop weight loss, you have to be on weight maintenance program, because one should not think that one can go back to the before weight management lifestyle. If that lifestyle was correct or okay, then person would have gained a very minimal weight or no weight. The lifestyle also is involved. Now, part of this may be controlled by mechanisms like central mechanisms, which are beyond the control of individual. But with treatment, we can modify those things also. Now, what was your question was about?
So I was asking about the best strategy to lose weight.
So best strategy. So first strategy is always lifestyle interventions and medications. If one is not able to achieve weight loss with lifestyle interventions and medication, then option is bariatric surgery. Now, bariatric surgery, there are different types, and one needs to discuss with the bariatric surgeon what is the best option. Now, important thing is, most of the people think that they will get operated and then after that there is no problem. One thing should be very clear to every obese or overweight individual, that lifestyle interventions have to be in place whether you are going for medical management or you are going to go for surgical management. Before and after the surgery, you have to follow lifestyle interventions, and they have to be ongoing for rest of your life. As on date, because we do not have anything to prevent regain. The only thing that prevents regain of weight is a healthy lifestyle, which includes, a healthy diet, significant decrease in junk food, regular monitoring of weight, and regular exercise. These are important things that you have to pursue for rest of your life to sustain weight loss. So it is not that after bariatric surgery, you can go and eat whatever you want to eat. No. You still need to maintain everything as per the guidelines given by your treating physicians. And second thing is, most of the people, try to lose weight by just cutting down diet or by over exercising. Those are not good strategies, because they don't last for more than a few days or a couple of months, and everything comes back. And if somebody is losing weight and regaining, and this process is repeated, this is called yo-yo, weight loss, then you tend to reset the brain's set point to a higher weight level. So every time somebody loses weight and regain is usually more than what person is lost. The second thing is, once there is repeat attempt for weight loss, the usually loss is less than what was the previous weight attempt. So every time you lose and regain, your set point keeps going up and up, and you tend to become more, resistant and stagnant in terms of weight loss is concerned.
Another very important question which comes to my mind is, does psychological factors play important role in obesity, stress, anxiety?
Absolutely. It is one of the major causative factors or contributing factors to development of overweight and obesity. And if somebody has underlying psychological or psychiatric disorders, this is a contraindication for bariatric surgery, because you know that this person is very likely to regain.
So is there any alarming sign which is given by body ki bas ab aur nahi?
Unfortunately, obesity does not give you any alarming sign. And that is why it remains untreated, or, one doesn't even bother to recognize that I am overweight or obese and I should consult a physician or nothing. And because it is largely asymptomatic, it is related to your physical appearance, which is, people can cover it, people can camouflage it, people like being overweight, people don't bother about it, it may consider sign of prosperity. All those factors are there. So not many people actually, despite being overweight, tend to take medical help or go for management of obesity.
Any other point you would like to add for today's session, maybe which I have missed or
I
not
think
touched?
we have covered most of the points. The most important thing is we should not close our eyes to development of overweight or obesity. Anybody who appears overweight or obese should, ask for medical help, discuss with the treating physician how to go about losing weight, adopt healthy lifestyle, adopt regular walking, keep monitoring your body weight on regular basis. Once you have gained, you can always, what you can do is that you don't gain further. And at the earliest opportunity, you should consult a doctor and plan for weight loss. Weight loss always should be a supervised, planned weight management program, which includes multi-specialty team. You need to have a physician, you need to have a dietitian, you may need to involve a exercise physiotherapist, you may need to involve a psychologist. So every component of weight is to be considered. That's why usually you need a team of people to manage obesity.
Very true, sir. So I think we are done with the session for the day.
Thank you. Thank you everyone for joining. And if you have any queries, please post on our page and we will reply to that. Thank you once again.
Thank you everyone for joining.